Physio Mike returns this morning with a focus on the feet. Today it's all about ankle pain. Mike Salame is a physiotherapist with Movenetics and joins us in studio once again. Good morning, Mike.
Good morning. How are you?
I'm good, thanks. I've rolled my ankles over the years, playing basketball and whatnot. So how common is ankle pain, and what are some of the sort of different things you see?
You beat me to it. I was going to ask if you've ever hurt your ankle. I think we all have from time to time.
Yeah.
It is quite common. I find that sports can bring out more ankle injuries than not, and also weather. Wintertime, we see a big uptick in ankle injuries, slips and falls.
Makes sense.
I find that the most common causes of ankle pain are sports, weather, age can play a factor. We find that wear and tear and arthritic changes can develop and show themselves at the age of 65 and older. Not all the time, but sometimes.
So when is pain most likely to hit? After you've sort of done some kind of, you've rolled it, or you've actually done the thing that causes the pain, I guess?
Well, it's a fair question, and we always break things down, and we've touched on this before, about MOI, mechanism of injury.
Okay.
So if you do have a roll or you slip on ice and you hear that pop or you have instant pain, we know what the cause is, of course, and then that has its own, system in terms of managing that pain. Sometimes people develop pain with no MOI. They'll just wake up and this pain is kind of there, and it gets worse as time goes on, and that's when people are super curious. They'll come visit me and say, Mike, I have ankle pain or I have foot pain. I'm not sure what the cause is.
Right.
And then that's when we dive in and do a thorough assessment, ask all the right questions, and see what the root cause of that can be.
Mm-hmm. And so how do you interrogate that? Do you go to the focus of like where the actual pain is, or do you go to what sort of practices people do? Like do you walk a lot? Do you do this a lot?
Exactly. That's a very good question. I think any patient that comes in, my first and foremost objective as a physio is to ask the right questions. I find that during our subjective history, I should be able to, more often than not, diagnose a patient by just asking the questions. Mm-hmm. And we tend to find with ankle injuries that some of them can be caused by overuse injuries. So, going from a lack of activity for a long time or a long stretch to an increase in activity. Mm. I also think it's important, I find in practice, not to complicate the ankle. It's got 4 ranges of motion that it's responsible for. You can point the toes forward, you can bring the ankle back.
Right.
You can go inwards and outwards. And a lot of the times when I'm assessing my patients and we just do a simple range of motion scan, they're super limited in certain ranges. So which one would you guess would be the most limited? Would it be pointing forward or bringing the ankle back, if you were to guess?
Probably pointing forward.
That is usually limited, but believe it or not, it's the one that's bringing it back that's
Really?
more limited.
Pulling back.
So bringing your ankle back is going to put your calves on stretch. And a lot of people have tight calves.
Yeah.
So I find that...
Guilty.
Yeah, you and I both. A lot of people are guilty in that. So the thing is, you had asked, let's say someone comes in with ankle pain, do we just look at the site or do we look at more of a global approach?
Right.
It's important to look at a global approach. If you have ankle pain, sometimes it stems from that limitation in range of motion. Most often, like I said, it's called dorsiflexion, which is when you bring your ankle back.
Okay.
So if you have a limitation in dorsiflexion, it can affect the ankle, it can affect the soles of the feet, we can develop plantar fasciitis, all because of that limitation in range of motion. You need a certain amount of slack in tissues when you walk or when you run.
Right.
And if we're limited, it might not show itself if we live a sedentary lifestyle, but once we get active, that's when it can show itself.
And you got the Achilles in there too.
Absolutely.
Right.
Yeah.
That's probably all related.
So Achilles is a common one as well.
Mm-hmm. So then how do you then tackle how to fix it?
So finding the root cause is super important. We talked about MOI. So if it's an ankle sprain or it's an ankle fracture, let's call it a sprain first of all. The most important thing would be to understand that there's a system that has to take place. There's that acute phase of rehab where it's kind of red, hot, and angry. Let's call that a week, depending on the severity of that sprain. Mm-hmm. So we're looking at ice, managing swelling, elevation, just kind of trying to control pain. Mm-hmm. Once we're out of that phase, range of motion, simple strengthening exercises, trying to walk, quote unquote, normally without a limp. Once we're out of that phase, we can look at dynamic exercise and kind of getting you back to real life. So that would be our approach to an actual mechanism of injury.
And then from there, how do you make sure it doesn't become chronic? I mean, I know people with all kinds of different injuries over the years that, oh yeah, my shoulder always goes on, my ankle is always
Right.
bothering me. And I would think that from a strengthening point of view, or how do you mitigate sort of not doing this over and over again?
That's a very good question. And I get asked by patients, for example, let's say you had an ankle injury. They'll say, Mike, let's say I never came to physio. What would happen? I mean, we go back 50 years, maybe 100 years, there was no physio.
Right.
It's a fair question. The answer I'll give is that the body is very resilient. The body's going to find a way to get you moving. Pain should settle. You shouldn't have a limp at some point. But what I think you'll be left with if you don't do the rehab is a bum ankle, right? So any given day
Is
you
that
walk
the official medical term, by the way?
up. It's what they taught us in school. So, and I think what you're left with there is, let's say one day you walk more than you normally do, or you go up a few flights of stairs and you get up to that last step and you're thinking, my ankle's a bit sore. So I think the root cause of that would have been a deficiency in either range of motion or strength and endurance.
Mm-hmm.
And that's where the physical therapy can come in, or a rehab program that's tailored to your injury.
Now, you mentioned arthritis as well. Does arthritis, and I mean, I don't want to get into the whole, arthritis can be a whole subject on its own.
Right.
But so when you injure yourself, does arthritis tend to attack an area where you've been hurt before?
It's a very good question. There can be a predisposition for arthritic changes if the injury is significant enough.
Yeah.
So, for example, if we talk about the knee, if someone had an ACL tear, the ACL is the main stabilizer of the knee.
Right.
So it's from the femur to the tibia. And if that is completely severed, day-to-day life, especially sport, can increase that joint play. It's a lot more friction than there would be typically. So if you fast forward 10, 15, 20 years, you can be fast-tracked for arthritic changes. Not all the time, but in some cases you can.
Or is arthritis common in the ankle?
No, not overly.
No?
Not overly. I mean, people need to understand, too, arthritic changes are a natural part of aging.
Right.
Which is why sometimes when patients have pain and they go get an x-ray and they come back with a page full of findings, I think sometimes in that position, my job is to calm their nerves.
Yeah.
Because, I mean, if you were to take an x-ray of any body region, for me, I'm sure I have arthritic changes.
Yeah.
Gravity is never going to lose. We're losing that battle from the day we're born. So, as long as we're maintaining healthy bodies, we're moving, we're strengthening, we're exercising, normal wear and tear should not be a concern.
Yeah. So move.
Move.
It's right there in the title of
In the MoveNetics name.
Yeah,
Move.
right there.
That's what we're all about.
All right. Thanks, Mike.
Thank you so much.
Mike Salame is a physiotherapist, owner of MoveNetics Physiotherapy in Edmonton. You can find him online on Instagram and TikTok at physio_Mike.